Welcome to Jersey Matters. I'm Larry Mendte. There is a new law named after a New Jersey woman who was murdered after she got into what she thought was an Uber car. The Ocean County prosecutor is here to talk about Sammy's Law. Major changes may be coming to Belmar, New Jersey. We'll talk about construction plans for the seaport. Big changes are coming for legalized sports betting in New Jersey, including possibly being able to bet on esports. And how the coronavirus is affecting New Jersey businesses and tourism in the state. But first, COVID-19, the highly infectious strain of the coronavirus, is dominating the news. You need to be armed with the best information available. Because of the constant flow of misinformation about COVID-19, let me give you some facts you can use and that you can trust, because I got them from the CDC and the World Health Organization. The reason there's so much concern about the COVID-19 virus is that it is extremely contagious. A brand new study out of the University of Minnesota confirms that you just have to be close to someone who has COVID-19 and breathe in the same air. They don't have to be sneezing or coughing. That study forced the World Health Organization to change its assessment that the virus could be contained. Still, the number one way to get the virus is through contact with an infected area and then touching your face, which is why the CDC is making the recommendation that you constantly wash your hands. That's not patronizing in the least. It actually works, and it can not only stop the spread of COVID-19, but the flu, which has killed many more people in the United States this year. 20,000 was the last estimate from the CDC. Speaking of the flu, there is great hope, even some expectation, that COVID-19 will subside in America over the next month. It will greatly diminish by the end of the flu season, which varies from year to year, but rarely goes into April. Other coronaviruses have done exactly that, and COVID-19 is just a nasty strain of corona. The only reason there is some question about this is because COVID-19 is new and they haven't been able to study it for a full flu season. Remember SARS, severe acute respiratory syndrome? That was also a strain of the coronavirus that started in China, but the fatality rate was much higher. It just wasn't as infectious. After the outbreak in China of SARS in 2002, it did spread to 17 countries and killed 773 people, but it just died out in 2004 because in that case, quarantine worked. So how deadly is COVID-19? The real answer is that nobody knows for certain, and I'll explain that in a moment. But let me give you the current figures. As of March 9th, in the world, there were 107,897 cases, and there were 3,658 deaths, for a fatality rate of about 3%. But that is just the reported cases. The truth is that the vast majority of people who get COVID-19 have mild symptoms, cold-like symptoms, and they don't even go to the doctor. In fact, the World Health Organization estimates that 80% of the people who contract COVID-19 show mild symptoms or no symptoms at all, which is why it spreads so easily, by the way, because those people are carriers. If you're a parent, you're worried about your children. So here's some good news. Children, for some reason, seem to have an immunity towards the virus. The vast majority of infants and small children show no symptoms at all. But, again, they are still carriers. You can see from this chart that the fatality rate, however, goes up with age. For children under the age of 10, there's only been a handful of cases, and no child has died. Between 10 and 19, there's been one death, and that teenager had underlying conditions. Going all the way up, you can see that 70 to 79 years old, the fatality rate is 8%. Over 80 years old, it's close to 15%. It's also important to point out that the deaths in all of the age groups in that chart had some underlying conditions. Most common was heart disease or diabetes. Researchers believe that COVID-19 is very similar to the H1N1 virus, that is a nasty strain of the flu, has infected over 61 million people worldwide and has killed 575,000. H1N1 is now one of the strains treated with a flu vaccine, and researchers are hoping that very soon COVID-19 will be treated the same way. Right now, several companies around the world are developing vaccines for COVID-19. Some of them are already in the testing phase. But even if the vaccines are fast-tracked, they're normally not ready for a year. I hope that helps. Be concerned. Be prepared. Wash your hands. But there's no reason for panic. We have been here before, and we've come out fine. There's no reason to believe that this time we won't be fine again. And as always, for the latest and reliable information, go to the Centers for Disease Control website, cdc.gov. Coming up next, a New Jersey woman dies after getting into what she thought was her Uber ride. Now there's a law in her name. The Ocean County prosecutor is here to talk about it when Jersey Matters continues.